Revelations.Unveiled.Detroit.
Family, family, family. We are back together again. I'm not sure if it was a snafu or a connection conspiracy. We were in the midst of our continuation of the COVID conundrum, calamity, and confusion with the C.D.C report outlining the missing data sets, the incomplete data, the reliance on foreign information to make recommendations and services available to Americans, the pediatric information that was not included. So, family, we will continue at the point where our connection was severed suspiciously, and we began the wastewater data for COVID-19 is also a much faster and more reliable barometer of the spread of the virus than the number of cases or positive cases. Well before the nation became aware of the data Delta variant, for example, scientists who track wastewater had seen its rise and alerted the C.D.C, Scarpino said. They did so in early May, just before the agency famously said vaccinated people could take off their masks. So, family, these mandates for the mask and the hygiene requirements and the spacing and all other rulings that have impacted society, even those who have lost their jobs through the unconstitutional mandates, even through the private sector pressures, you are not getting all that you needed to make your decisions. Even now, the agency is relying on a technique that captures the amount of virus, but not the different variants in the mix, said Mariana Mattis, CEO of BioBot Analytics, which specializes in wastewater analysis. That will make it difficult for the agency to spot and respond to outbreaks of new variants in a timely manner, she says. So the premier agency of disease control and prevention is not on the forefront of analysis of data, family. It gets really exhausting when you see the private sector working faster than the premier health agency of the world, Rivera said. So, family, now critical mass has been accomplished where they have the millions of Americans and those of the global population that were injected with these vaccinations and boosters. People lost their jobs. Livelihoods were affected. Our society was shut down, reopened, and shut down again. You have been pulled and pushed and squeezed and pressed and stretched in accordance with trying to maintain health, sanity, and the rules of society. How do you make a decision without all of the pertinent information? How is a government agency able to give government information that is incomplete, that is then filtered to you on a daily basis, that is affecting your very lives. How does one feel when many are called conspiracy theorists, even if they are premier doctors and practitioners of medicine and biology and virology and chemistry, when they say that these serums, these injections are questionable? Why is there so much silencing and censorship when one wants to speak their own spirit in accordance or application to their belief in COVID-19 and what is being presented? Why all of the backlash for those who wish not to put that foreign agent that was manufactured by the pharmaco cartels and financed through our politicians and celebrities to foist on the American public? How should you feel with the inundation of information that was created for a specific purpose? Was the purpose health? Did it have a sinister agenda? Were they going with the flow? Were they all in the know? Follow the money. What happened to the pneumonia and the flu statistics for the last 3 years? How come it was revealed that all deaths were somehow associated with the COVID-19 virus, even if patients were hospitalized for other factors? Was it COVID? Was it the flu? Was it pneumonia? Was it respiratory pre-existing conditions and infections that contributed to the cacophony of this collection of questionable detail? So, family, how do we proceed? What does critical analysis of the disclosure of the very agency itself lend or tend to your sentimentality? How will we go forward when the countries themselves are now starting to exterminate data so as not to come into conflict with the pharmaco cartels and the exorbitant increasing profits that they have made off of the global public in the last 3 years? Where is the crossroad? Where is the threshold of truth? How will we, family of the diaspora, continue to navigate through this continent of colonization, captivity, and confusion? What is the next step in our zone of care, compassion, and concern? We shall see. We shall see. And until we are together again, I love you. I love you. I love you. To be continued. Revelations.Unveiled. Detroit.